to do it that is getting
Like,
threatening
boys are a
emails.
little bit more like introverted, and the gaming I think is very appealing to them. And your kiddos are older now. Like I'm talking this new young generation. It's different.
Let's see, I think maybe this is yours.
It's like 100. Oh, I thought this was mine.
Maybe it is.
Gaming, even in the last 5 years,
I take yours.
so dramatically changed. Everything, you talk to their friends on these headsets. So they're like
I was trying to get stuff out of the way.
the pods. So they don't actually see their friends on these days. It's just all these virtual networks of gaming. Epidemic.
Board motions.
Like force them.
Tell 'em. Just gets to be so.
Exactly. It's like prison. You get the 60 minutes in the in the courtyard to walk around. You don't have a choice.
Created all kinds of weird questions, right?
My kids, it's like all my friends and their kids. It's like
You're looking at strategies.
sure.
What are the strategies?
I mean, it's like different. It's like a carrot and a stick. You can have your few hours of
Yeah, the Herald Tribune came out really nicely.
outside and go swimming. I mean, I feel like
Oh, 12:59.
you bribe them to go swimming and be outside and walk the dogs. It's absurd. I did wrong. And they're only a year apart, so like they're
Two against one. Two against one. I think this is about the longest motion.
10 seconds.
is everything's great.
For a new record.
4, 3, 2,
For a new record.
1.
Let's stand for the invocation from Dr. John Gerhardt.
Dr. Chairman Malone.
May we bow our heads and pray together. Lord our God, as we begin this meeting of our hospital board, we pause to give thanks, to intercede, and to ask for your divine hand of guidance and blessing. We give thanks for this phenomenal hospital system that provides us the venue through which we can care for our neighbors in need. Strengthen our staff, we pray, as they pour out their lives in the service of others. Grant favor upon our heartfelt efforts to bring healing to those we can, and help us to offer the deepest of compassion for those we cannot. We ask for wisdom from heaven above for our leaders and this, our hospital board, as they guide and direct this great hospital as we care together for our community. These things we pray. Amen.
Let's join together for the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We'll call the meeting to order of the Sarasota County Public Hospital Board on June 15th, 2015. Let me redo this. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. We have approval of the minutes of the meeting of May 18th.
So moved. Second.
We have a motion and a second. Any additions or changes? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Thank you. Motion carries. And we'll move on to an exciting meeting event here, the stroke program update. by Dr. Concha, and I think you're going to make the introductions, aren't you, Dr. Fiorica?
Yes, I'm happy to introduce Dr. Concha. Mauricio Concha is a board-certified neurologist and vascular neurologist. He received his undergraduate training in Columbia and then went on to do his master's in health and epidemiology at Johns Hopkins University. From there, he did an internship in Baltimore, Maryland, and was a research fellow in neuroepidemiology at Johns Hopkins. He finished his residency in clinical neurology at the University of Miami, and then he went on to do a fellowship in dementia and cardiovascular diseases at the University of Miami. He's a board-certified, fellowship-trained stroke specialist and directs the stroke team. He's the medical director of Sarasota Memorial's comprehensive stroke program, and he's here to talk about the program and what we're doing here at Sarasota Memorial. Thank you.
Thank you very much for that introduction, Dr. Fiorica. It's an honor to be here in representation of a large group of professionals of Sarasota Memorial and a very supportive administration that works very hard to deliver the best quality of stroke care possible in today's world. As you may know by now, in April, we obtained the highest level of certification a stroke center can have. We are a comprehensive stroke center certified by DNV. What does that mean? What it means is that in Sarasota Memorial, the Sarasota Memorial Hospital offers the highest standards of stroke care, from diagnosis to treatment to research, rehabilitation, and education. It offers a wide spectrum of therapeutic possibilities for all types of strokes, and we do that through the latest clinical advances and technologies. And as a result of this, we act as a referral center for acute-ready and primary stroke centers around the region. And this is because we bring together a variety of leading experts in various disciplines. Our journey started back in 2005 with our first Joint Commission certification as a primary stroke center. And since then, we have obtained 5 recertifications and multiple awards by the American Heart and the American Stroke Association. And these awards are in recognition of our accomplishments of high standards, such as the Target Elite from the American Stroke Association that we obtained this year. This recognition is given through stroke centers that are able to deliver intravenous thrombolytics in less than 60 minutes in more than 75% of the patients that are treated with this drug. This graph depicts 3 pieces of information that are worth highlighting and sharing with you and the public. The first one is the blue bar. And as you can see, we're treating more patients with intravenous thrombolytics. In 2014, the increase was nearly 50% in comparison to the previous year. And this is the result of our efforts in educating the public in awareness and recognition of the stroke, in working very close with EMS, so they also recognize the stroke and work as a team with us, so they give us a heads up so we can be ready here in the hospital to receive the patients and treat them fast and appropriately. Now, the red bar depicts the percentage of patients that are treated with intravenous thrombolytics under 60 minutes. So not only are we treating more patients, but we're doing it faster. So 80% of the patients that received thrombolytics in 2014 received them under 1 hour. But perhaps most impressively is that half of those receive it under 45 minutes, and that's the green bar. And we are approaching a 50% mark. That's our goal, that 50% of our patients will receive the drug under 45 minutes. Remember, time is brain, and that's what we're trying to achieve here. Now, back to what makes us comprehensive. So in addition to the extraordinary group of neurosurgeons and emergency physicians, highly trained nurses, radiologists, and neurologists, Dr. Daniel Case joined us 2 years ago. The role of acute intervention or endovascular intervention had eluded us for several years. But that landscape has changed. This year, 5 scientific trials proved the benefits of such therapy. I'm referring to therapies that use catheters to go into the brain blood vessels and extract the clots, very much like the cardiac catheterizations. And as a result of that, we have created algorithms to facilitate and to speed up the way we select patients, because this is obviously not an appropriate therapy for all stroke patients. So this graph depicts the fact that this year alone, the first 5 months, Dr. Daniel Case and the stroke team have been able to treat 25 patients in the combined strategies with intravenous thrombolysis and endovascular therapies. And that is nearly double what we did last year. Now, these algorithms, what they imply is that as a team, we have to diagnose and identify very quickly those patients that require certain therapies, or they will benefit from the different modalities that we have to offer. So the first thing we have to do is to determine whether a stroke is ischemic or hemorrhagic. Ischemic makes up about 80% of the cases, and hemorrhagic strokes occur because there's a rupture of a blood vessel, and that's about 20% of the times. If it is ischemic, then the neurologist and Dr. Case will assess the candidacy for intravenous and or intraarterial thrombolysis. Sometimes we use both in combination. So this is an example of the things that we can achieve here. On the left side, you see how a main artery of the brain is occluded, is blocked by a clot. And on the right side, you see the successful recanalization of that artery and the reinstitution or reconstitution of the blood flow to that side of the brain. And you can see the clot that has been extracted below. So sometimes these clots dissolve by themselves using the thrombolysis if we use it rapidly enough. But however, sometimes we need to go to the intervention and the types of treatments Dr. Case can offer so that we can accomplish these results. As you can imagine, this is a very complex process that if we want to do it rapidly, it needs to be well choreographed. And that's what the program works on day in, day out. Now, turning to another aspect of stroke, that is the hemorrhagic strokes. These occur whenever there's a rupture of a blood vessel. And this is an example of aneurysms. These aneurysms occur because there is a congenital defect of the wall of the blood vessel. And when they rupture, it is a true emergency. And the consequences of these hemorrhages are devastating. High mortality, terrible disability. So it is an emergency, and we need to act very quickly. So as part of what we do, the neurosurgeons meet with Dr. Case on an urgent basis when these patients come in, and they decide what is the best treatment, whether to take them to surgery or treat them with non-surgical interventions such as coils or stents, like they are depicted here in this cartoon. And in fact, today, 70 to 80% of these aneurysms are treated with non-surgical procedures, those that Dr. Case can provide. Now, lastly, I want to mention the following. Up to now, our main focus in the program has been on the upfront of the problem. That is sort of putting out the fire, treating very rapidly when the patients come with a stroke. Obviously, there's much to gain with the therapies that we can offer today. However, the reality is that because of these treatments precisely, more patients are actually going home with minimal to no disability. And in fact, when we looked at our data, 70% of our patients end up going either home or to inpatient rehabilitation. So as a consequence, the patients are going to be exposed to the reality of living with the risk of having another event, whether it is a stroke or a cardiac problem or a vascular event of some sort. So this is why we are now, without losing attention to the front end of the problem, focusing more on the longer sort of exposure of that risk. That is on the secondary stroke prevention, on the education, and the promotion of a healthier lifestyle. And for that, we're taking advantage of the wonderful resources that Sarasota Memorial Healthcare System can offer. And that includes the Healthplex Center, physiologists, nutrition department, stroke specialized rehabilitation staff. So we have created the post-wellness the post-stroke wellness program. In this effort, we up to now have created a stroke prevention and education clinic that facilitates the transitional care of the patients once they leave the hospital into the community, into their homes. This clinic also serves as a specialized clinic to provide stroke care for those uninsured patients. We have developed a strong support group that meets monthly. We have a monthly lecture series on stroke topics to educate the patients and their relatives. We have even developed cooking classes so that we teach patients and relatives to cook healthier and have healthier options. And basically, we keep creating and developing programs with the community so that we can bridge that gap between our intramural program and the community, all towards accomplishing a sort of healthier community and preventing readmissions with more strokes. Thank you.
Thank you very much. Any questions for Dr. Concha? Yes, Alex.
Yeah. Strokes, like many other cardiovascular diseases, increase with age. And so our population demographics is such that we continue to see most of the cases in their 8th and 9th decades. So our median age in the population that we treat is about 74 years of age. However, having said that, strokes can occur at any age. And it's not unusual for us to treat patients in their 40s or 50s with strokes.
Thank you again for all the wonderful work you all do and for the presentation.
Thank you.
And next we have the Excel winner, John Nellums, Healthfront ER Associate at Healthfront.
Come on, John. How you doing, my friend? Good. So you come stand over here. All right. I want to make sure you're in frame. Okay. So I am thrilled today to get to talk about my friend here, John Nellums, who is our Excel recipient for the month of June. John is a Healthfront ER Associate. He's been an employee of SMH since February of 2013. John entered the new role of the Healthfront ER Associate with an open mind and a desire to help each person coming into our emergency center. He has helped make the ECC lobby area more comfortable and provide a warmth and calm in person to a person's in anxious situations. He brings an exemplary level of service day in and day out. John's nominations describe him as absolutely phenomenal. His name is mentioned over and over again on patient satisfaction surveys as someone who should be recognized for his exceptional service. So usually, John, we read a couple comments from your peers. Today, we're going to read comments from some of your peers and patients, because so many patients comment about you and what you do every day for them. So here's a few of them. A professional with a positive attitude, friendly, kind, caring, and considerate. A godsend to our department, consistently goes above and beyond, a spirit lifter, comforting and reassuring. John is on the spot, someone who makes a difference. Love this one. Love the guy handing out comfort items. Great idea, except it wasn't serving martinis. I'm assuming that was a patient. The gentleman attending our needs in the ECC was something I've never seen before in a hospital. I was very impressed. So John makes a difference every day and will do whatever it takes to exceed expectations for our patients and families. They may not know his name, but they know to look for the guy in the green shirt. We are so fortunate to have him as a wonderful employee. So thank you so much, John.
Thank you.
Small recognition of a plaque, but for everything you do, the board wanted to recognize you. The Excel recipient, June 2015, an employee recognition program of Sarasota Memorial Healthcare System, The hospital board and the administrative staff of Sarasota Memorial Healthcare System are grateful to all employees who constantly enhance the quality of a patient's stay by making an extra effort in their daily activities. The Excel program is designed to recognize employees who have distinguished themselves by superior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in the community. The hospital board and the administrative staff are pleased to present you, John, with the Excel Award for June 2015 in recognition of your demonstrated courtesy and caring attitude and contributions towards excellence at the Sarasota Memorial Healthcare System. Signed by David Veringer, CEO, and Dr. Margaret Malone, Chair of the Sarasota County Public Hospital Board. Congratulations, John.
Thank you. Thank you. Sir? All I can think of, this is such an honor to receive this award. It's humbling. It's just, I want to thank the board. I want to thank the hospital staff and administration just to be able to be given the opportunity to help where I can and just represent the hospital in a positive manner. I just want to say thank you, and I will continue to do what I do and just serve the best I can in any way. So I appreciate it.
Thank you so much.
Keep it this time.
I appreciate it.
And next, the report of the medical staff. Dr. James Fiorica, Chief of Staff.
Yes, I have 3 action items for the board to consider. The first is approval of a new reference lab, Verisight Laboratory, to the list of approved reference labs.
I move approval of the addition of Verisight Laboratory to the list of approved reference laboratories as recommended by the Medical Executive Committee.
We have a motion and a second. Any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
Second is approval of a consult attestation ordered by allied health professionals as approved by the Medical Executive Committee at the Medical Executive Committee.
I move approval of the process of attestation of physician determination of necessity for allied health professionals ordering consults as recommended by the Medical Executive Committee.
We have a motion and a second. Any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And third, it's an approval of observation patients admitted to the short stay unit to be managed at the short stay unit and the short stay team involved in their care as recommended by the Medical Executive Committee.
I move approval of the protocol requiring that with limited exceptions, all observation patients be admitted to specified units and that the short stay team be consulted on all such admissions as recommended by the Medical Executive Committee.
We have a motion and a second. Any comments or questions? If not, all those approving the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much.
That concludes my report.
Thank you, Dr. Fiorica. We'll move on to the auxiliary report. Mr. Ed Miller.
Thank you, Madam Chair. The summer has begun with several exciting projects, 2 of which I would like to share with you today. The first is the pet therapy program, which has been in place for almost 2 decades. It is an integral part of the Departments of Comprehensive Rehabilitation, Pediatrics, and Oncology. We have been requested to broaden the program and include 2 additional teams to complement the current program. Our pet therapy members attended the annual in-service to review protocols and then welcome 5 prospective human/canine teams to be interviewed for our program. Our pet therapy program is comprised of dogs of various sizes and breeds, all of which are certified by accredited agencies for pet therapy. We have many wonderful stories of how our pet therapy visits have created healing moments in the lives of our patients. second program is about our teen volunteers. While our teams serve throughout the year, summer brings the largest number of participants. This number, we have 103 teens serving Sarasota Memorial Health System and the departments of Courtyard Tower, Discharge Services, the gift shop, and clinical research. Hospital and department orientation took place on June 9th and June 11th. By the way, to have those young people in our cafeteria would not have been good, so we bought box lunches for them and took care of them outside of the cafeteria. Many of our teams continue to serve long after the 75 hours of service has been completed. Indeed, we have several of our juniors and seniors who have been with the hospital volunteer program for between 400 and 500 hours. They are a great asset, both in service and as mentors to new teens. We have had many of our teens go on to pursue healthcare careers as a result of their teen volunteer experience at Sarasota Memorial. That concludes the report, Madam Chair. Thank you.
Thank you, Mr. Miller. And now the Sarasota Memorial Healthcare Foundation, Ms. Alex Quarles, President.
Thank you, Madam Chair. I have no report today.
Thank you. We'll move on to the Secretary's report. Thomas Towler.
Madam Chair, I have the July schedule for the board meetings. The first is on Tuesday, the 7th of July at 8 o'clock, the board breakfast, 9 o'clock, the Quality Committee, 10 o'clock, the Finance Committee, and 11 o'clock, the Audit Committee. And then on Monday, the 20th of July, we meet with the public board meeting at 1 o'clock. Madam Chair, that's my report.
Thank you very much, Mr. Towler. And we'll move on to the Treasurer's report. Mr. Joe DiVirgilio.
Just one item this morning, and that is approval of the bad debt and charity care. I move approval of the bad debt and charity care for the month ending May 31st, 2015, in the amount of $11,707,000.
We have a motion and a second. Any comments or questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. Thank you very much. So operations reports, starting with Mr. Bill Wojin, Chief Financial Officer.
Thank you, Madam Chair. I have the financial highlights for May 2015, which is the 8th month of our fiscal year. For operating revenue for the system, for the month of May, $53,896,000, compared to a budget of $47,192,000. For fiscal year to date, again through 8 months, $426.3 million, compared to a budget of $389.2 million. Looking at the system's total expenses for the month of May, $49,541,000 compared to a budget of $47,677,000. Fiscal year to date, $401,419,000 compared to a budget of $385,398,000. Looking at our operating income in the rating agency format for May, $6,997,000, which generated an operating margin of 12.1%, compared to a budget of $2,220,000, or an operating margin of 4.4%. Through 8 months of this fiscal year, actual of $46,391,000, for an operating margin of 10.2%, against a budget of $25,488,000, budgeted operating margin 6.1%. Moving to statistics for the hospital, and this is fiscal year to date numbers. The average daily occupancy, 454 patients compared to a budget of 392 patients. The average length of stay, 5.03 compared to prior year of 4.60. Admissions, again through 8 months, $18,748, compared to a budget of $18,059. Surgical cases, 13,323, compared to a budget of 12,810. And so far through 8 months, we have had 2,169 births, compared to a budget of 1,935. Hospitals outpatient registrations through 8 months, 284,064, compared to a budget of 285,789. Emergency care center registrations total 78,661, compared to a budget of 69,813. And our case mix index so far this year, 1.73 for all patients and 1.93 for Medicare patients. Madam Chair, that concludes my report unless there's any questions.
Any questions? Thank you very much. And next, Ms. Jan Mock, Chief Nursing Officer.
Thank you, Madam Chair. Good afternoon. Gives me great pleasure today to introduce to you Lisa Collins-Brown. She's our new ECC director. You can come up here. She came to Sarasota Memorial as a supervisor and flow coordinator, and that's when we saw all of her wonderful talents. She then was put into the interim ECC director for the last 3 months and did a fabulous job and opened our trauma bays and set up the trauma program for the emergency room during that time. She came to us from Venice Regional, where she was the director of the emergency room there. And prior to that, she was an ECC director at the VA hospital in Ann Arbor, Michigan, and was in the VA system for some time. Reuben Holland, who's the medical director of the emergency room, and I are very happy to have her in this very important role. And again, I'd like to introduce you to Lisa Collins-Brown.
Well, welcome.
I'm just very happy to be here. I'm very privileged, and I appreciate the opportunity. So thank you.
Thank you.
Thanks.
In front of you, I passed out earlier, you have an article that got published by Dr. Pam Beitlich in Nursing Management. And it's really a project that the hospital has gone into as we embark on our patient safety culture. And in that, she talks about the team steps implementation in the labor and delivery and NICU setting, in which was our first pilot in rolling out the Team Steps project. Team Steps is basically started in 2003 after evaluating more than 25 years of research on teams and team performances. And the Agency for Health Research and Quality worked together with the Department of Defense to develop a comprehensive evidence-based team training program called Team Strategies and Tools to Enhance Performance, or as we know it, Team Steps. We're very proud of the work that was done in labor and delivery, and in this article it talks about the outcomes, and now we're rolling that out through the rest of the organization in our high-risk areas as well as in the areas that cover the whole organization. So we're very proud of Pam for her work there. Also, a couple things going on in that arena, as you can see on the screen here. We are seeking baby-friendly hospital designation. And Baby Friendly USA recognizes hospitals that provide the finest evidence-based maternity care with the goal of achieving optimal infant feeding outcomes by implementation of 10 steps to successful breastfeeding and adhere to the International Code of Marketing for Breast Milk Substitutes. And it's very well, as you can see, supported by the following organizations. And why would we seek this designation? Obviously, to improve health outcomes for mothers and babies, to help meet the Joint Commission maternity care standards for exclusive breastfeeding, to improve SMH's maternity care practices benchmarking scores as collected by the CDC, to achieve healthy people 2020 goal for breastfeeding and to improve patient satisfaction and elevate the reputation of our hospital. We would be among the 4th hospital in Florida. You can see Tampa General, Shands, and Lee Memorial have this designation, so we're very proud to be seeking that. And we have also asked and applied for a grant, and we haven't heard yet, but to help support that. And I won't go through the 10 steps, but they really involve the issues of breastfeeding as well as rooming in. And those 10 steps, we are doing all of those now, so we're very confident that we will achieve this designation. The next thing I wanted to talk about is really enhances this, and as we promote breastfeeding, we basically have become a depot for donor milk in the NICU, and this is really a service to our community so that mothers can drop off their breast milk that then will be sent to the breast milk bank. This increases the availability of human milk for babies in the NICU, which is an important initiative and significant health benefits for sick and premature babies. The Human Milk Bank of North America, who oversees milk donations and safety, much like a blood bank, have milk banks in many states, and they just are opening one in Orlando for the first one in Florida. We work as a depot for the milk bank will help make the donation process easier for mothers in our community and position Sarasota Memorial as a leader in the community on this important health priority. It will function literally as a drop-off point for moms and shipping point for the milk bank in Orlando. And so we're very proud of that. It was very much supported this last time by the OBGYN department, and we're very excited about that for our community. So we'll be getting information out to the physician offices and having information for the community on that issue. Last month, Lori talked about the status of the Red Wing and where we're going with our rehab pavilion. So we're on schedule in June and July, which we are now in. The internal abatement will be happening in the Redder building. And also in June and July, we will be having a fire department, a SWAT team, and our public safety department will have a very well orchestrated technical operations for institutional structure. So they will be doing training in this building. And then in August, the interior demolition will take place. And in September, the exterior demolition, and for the first week in November, the building will be coming down. So that just gives you an update on where we are. As you know, we're preparing for the budget, so we've started in April the budget process, and I want to thank Bill and his team for their hard work during this very important time, and also the leaders who are preparing their budgets for the board workshop, which will be in August. We had a downtime, our health electronic medical record downtime this last Friday. And it only took 4 hours, so it was quite rapid. And I'd like to recognize Robert Arterio for developing a new downtime environment called View Plus, which allowed all information, all results, people could document in the electronic medical record and limited paper. And this was all part of a process improvement to make sure that we had the safest environment for our patients while we were experiencing a downtime. So I want to thank Pam Ramhofer and her team for all their hard work and support during this time. And we are currently working on a few little glitches and challenges with a little bit of slowness, but we're working through that. And the last thing is Sarasota Memorial Rehabilitation Pavilion. Tom gave me a report this morning. And the city commissioner approved our plans for the rehab pavilion by consent. So there was a scheduled public meeting today, and there will not be a need for one. And I have a few photos to share with you with the latest renditions. But the next step is then to get our building permits, so we're well on our way. So anyway, you'll see those later. There's just two, one of the outside and one of the inside of the rehab. So, and that ends my report unless you have any questions.
Any questions? Thank you so much.
Thank you.
There are no board reports today, so we'll move on to committee reports. And the Governance Effectiveness Committee, Ms. Alex Miller, Chair.
Thank you, Madam Chair. The Governance Effectiveness Committee met on June 2nd. First, as a follow-up to the board's self-assessment survey, Board Counsel Caroline Kalish presented a brief overview of Florida's government in the Sunshine and Public Records Law. Key topics included what constitutes a public meeting and the requirements for notices and minutes of public meetings. Next, we had a review of board bylaws. Board Counsel, again, Caroline Kalish, discussed the bylaws in general as part of this committee's periodic review of bylaws. As a result of that review, a change was discussed regarding the composition of the community members on the investment committee, and I have a motion. I move that we amend Section 3G of the board bylaws describing the community members of the investment committee to delete the phrase, quote, from the finance committee, unquote, from the description as recommended by the Governance Effectiveness Committee.
We have a motion and a second. Are there any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much.
Lastly, we discussed the vacancy on the investment committee for a community member. Committee reviewed the applications and resumes received in response to the ad placed in the Herald Tribune. After discussion, the committee agreed to appoint Martin Kossoff to serve as community member on the investment committee, and I have a motion. I move that we appoint Martin Kossoff as the community member to the investment committee as recommended by the Governance Effectiveness Committee.
We have a motion and a second. Any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And that concludes my report.
Thank you very much. So next, the Mission and Planning Committee, Mr. Greg Carter, Chair.
Thank you, Madam Chair. The Mission and Planning Committee also met on June 2nd, and we started out with a report from Lori Lang, our Chief Operations Officer, on a Northport land swap, and she provided background on the Thomas Ranch property, which was purchased in 1996 and consists of 128 acres. Lori discussed the location of the land and also geographically showed the land location of the property proposed in the swap. Benefits of the proposed site were discussed as compared to the current location. The new property is located directly on US 41 as a signalized intersection, and this will be a 30-acre site with 20 acres available for development. At this time, I move approval of the trade of the district-owned 128-acre Thomas Ranch property located at 19501 and 19503 Southwest Villages Parkway for a 30-acre property located at the corner of US 41 and West Villages Parkway, with additional consideration of no less than $3.25 million, which includes closing costs and which will result in net proceeds to the district of no less than $3.19 million at closing, along with such authority as necessary for the President and Chief Executive Officer to negotiate and sign a commercially reasonable agreement related to the transaction consistent with the above terms and recommended by the Mission and Planning Committee.
We have a motion and a second. Are there any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
Okay. Our next item was the replacement of 2 CT scanners. And Debbie Bohannon, Director of Imaging Services, provided background information relating to the replacement of 2 CT scanners on the main campus. Cedars-Sinai in California brought forth an industry problem of potential overexposure to radiation from CT scanners. She explained the various levels of radiation provided by different machines and provided examples. She briefly discussed the industry response from the FDA, Medicare, and radiological societies. Deb then presented the CT scanners in our system. all the scanners are compliant with the new CMS guidelines except for 2 of our oldest in the main campus. Replacement of the 2 CT scanners will allow the organization to continue current radiology services and have a backup if a CT scanner goes down. This will also ensure that scanners are CMS and FDA compliant. The 2 new scanners in question will be, the 2 old scanners in question will be at the end of their useful lifespan, January of 2016. At that time, maintenance agreements and replacement parts will be difficult to obtain. Benefits were discussed, including the redundancy. Medicare's response was presented in terms of penalties for continuing reimbursement by not being compliant. The cost of replacement was presented, including relevant construction costs. At this time, I move approval of the purchase of 2 CT scanners for a total project cost of $1,331,920 to be allocated to the budgets for this year and next year as follows: $1,211,527 in this fiscal year and $120,393 in fiscal year 2016, as recommended by the Mission and Planning Committee.
We have a motion and a second. Any questions or comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And the next item was wireless network replacement. And Pam Ramhofer discussed the wireless network replacement, which is at the end of its useful life, and the system-wide demand on the current wireless system has outgrown the network capacity. The project will include complete integration of the new wireless network over a 1-year period. This will increase speed, reliability, and security. Pam then discussed issues of network stability, connectivity, and loss of connection. These issues have a huge impact on the critical communication systems and clinical processes. The benefits of the new wireless network were discussed and include faster ability to meet current and future needs and the ability to detect devices and make advances in management solutions. It is critical to begin the process as soon as possible and do as much as possible when the census is lower. So I move approval of the purchase of a replacement wireless network for the total project cost of $2,400,000 to be allocated to the budgets for this year and next year as follows: $400,000 in this fiscal year and $2 million in fiscal year 2016, as recommended by the Mission and Planning Committee.
We have a motion and a second. Any comments or questions? If not, all those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And lastly, was an update on veterans' access to health care. And Lori Lang also provided an overview of veterans' access to health care. She reported how veterans access care defines who qualifies as a veteran, reviewed their choices of health coverage, and who has priority. The VA versus TRICARE and CHAMPUS models were discussed. Lori stated that we are addressing this issue today as a result of the recent VA scandal. Florida's Region 8 has St. Petersburg as a hub, and services offered in St. Petersburg were discussed. Lori discussed the primary care model, and local Sarasota options were provided. Local wait time data and Sarasota Memorial provider access were reviewed. In fiscal year 2014, Sarasota Memorial usage include approximately 300 inpatient visits and 2,400 outpatient visits. The top 25 inpatient and outpatient DRGs were provided, and Lori summarized that the VA system works well in Region 8, with wait times sometimes being often better than the private sector. And that concludes my report, Madam Chair.
Thank you very much. So we'll move on to the Quality Committee. Mr. Robert Strasser, Chairman.
Thank you, Madam Chair. Since the Quality Committee meets in closed session, I have nothing to report at this time.
Thank you. So on to the President's report. Mr. David Verner, President and CEO.
Thank you. I am going to start today, like we normally do, with our leader report card for fiscal year to date, May 2015. And we start in the service pillar and we look at our HCAP scores. We have a goal of hitting 9 out of our 11 indicators at a 50th percentile or better. We are a tad bit under that. We're at 8 out of our 11 now. So we have a lot of teams focused on that to get us back up to that number. On our outpatient indicator is a percentage what likelihood of recommending. We have a goal of being at the 83rd percentile. We are currently at the 84th percentile, so doing 1 point better than our goal. In the people pillar, we have merits on time. Our goal is to make sure we do our merits on time 95% of the time. We are still a little low on that. We're at 91%, but we do have action teams around that working on that now. Turnover, we have a goal of being at 16% or less, and I'm happy to report we are at 13%, so we are seeing some good positive direction in that still. In the quality pillar, we have organization percent of patient safety readiness. Our goal is to be at the 95% or better. Happy to report that we are at 98% as of today. In our infection prevention, combined overall standardization infection rate being less than 0.95, and I'm happy to report we are at 0.94, so doing just slightly better than our goal. Under the finance pillar, as Bill has reported, we have a goal of 4.4%, which is our budget, and as he reported, we have a current projection of hitting 7.4% for the year. In the growth pillar, we have strategic growth organizational goals, inpatient admissions, the goal is 26,308. Happy to report we are exceeding that at 26,991. In outpatient registrations, a goal of 657,000, and we are exceeding that as well at 678,000. So we look into our HCAP scores a little bit deeper. You will see in our fiscal year 15 to date, we are 8 out of 11. As you can see, there's 3 indicators that we are below the 50th percentile on: responsiveness to hospital staff, quietness of the hospital environment, and communication about medications. All are being worked on by a whole host of people throughout the organization, and hope to have some better numbers soon. On the outpatient side, you can see that we put everybody in different categories. Those at the 85th percentile and better, which is on the far right, in the middle of in the 50th percent, and in the departments that are below the 50th percent in the far left. And I'm happy to report that we've been able to move a number of departments from that far left and move them into the middle column, with some still to have some work left to do. And then obviously those in the middle we'd like to move to the right-hand side, but making progress. Moving into people, we had last month, Sarasota Memorial held its annual service anniversary celebration, honoring staff who were marking their 5, 10, 15, 20, 25, 30, 35, 40, and even some 45 years with the organization. We did have special recognition was given for 2 very special long-serving staff members who each celebrated an incredible 45 years. Desi Peterson of Environmental Services and Joanne Fothwar of Health Information Management. We want to extend a very big thank you for their service. I will also note that this is the first time we've had 45-year people. We had to make up a special pin for that. So it was a nice thing to have happen. Staying in people, this is just an article that came out in the Tampa Bay Medical News about our own Dr. Karen Hammond, who will be, coincidentally, our chief of staff next year. It was a great little article, wonderful and touching personal story on Karen, and I would invite you to take a look at that when you get a chance. Staying in people, every year we have our foundation's EPIC Drive, which is our Employees, Partners in Caring campaign. It has a whole host of fundraising activities, but one of them that I think this is the second year, Alex, that we've done the bartending. So we had a celebrity bartending event at Libby's, and we raised $1,650. And just wanted to congratulate our top folks that are doing that, Frank Morgan, Dr. Jim Coco, and Dr. Karen Hammond. And then just so you'll know who you have in the pictures here, on the top picture you have Dr. Paul Vesco, Frank Morgan, Dr. Reuben Holland, Dr. Jim Coco. And in the bottom picture, you have Dr. Jonathan Hofberger, who's our newest cardiovascular surgeon, Dr. Karen Hammond, Dr. Jeff Sell, Dr. Jerry John, and Gene Lucas. So we thank everybody who participated that day. Staying in people, we have our own Eileen Gilbert, who is our Chief Operating Officer for First Physicians Group, passed the American College of Healthcare Executives Board exam. And by passing this, she's recognized as having board certification in healthcare management as a fellow of the American College of Healthcare Executives. So just wanted to pass a big congratulations on to Eileen for her dedication. Usually we don't have in my presentation birthdays, but we thought it was kind of a special one to do this time. In honor of his 60th birthday, our Heart and Vascular Services Executive Director, David Patterson, who is a retired Marine, was presented with a certificate from Dr. Jeff Sell honoring his newly accomplished status of Old Marine. I didn't know there was such a thing, but there apparently is. Sergeant Jonathan Anderson from the local Marine Corps Recruiting Command was also in attendance with David's family. So happy birthday, David, and thank you for your years of service to our country. You may have noticed we have a new area of the hospital for the public and for information. It's right across from the gift shop that our auxiliary runs. And you saw earlier we gave to Jonathan the Excel Award, and he wears one of these green shirts and is really one of our founding members in here. But visitors and staff have been checking out our Health Connection since it opened on the first floor last week. The center offers a wealth of health and wellness resources to health front staff, the helpful employees in the green shirts who assist our visitors and patients on the first floor will also work in Health Connection alongside our health coaches. Not sure how many more times we could say health in that paragraph, but we'll try. I would encourage everyone to if you haven't had a chance, go by and visit to public members of the public as well as our board members. Going into quality and safety, Sarasota Memorial's Critical Care Unit was awarded the Silver Beacon Award of Excellence from the American Association of Critical Care Nurses. The Beacon Award for Excellence recognizes caregivers who consistently and systematically provide approach to evidence-based care, optimizing patient outcomes in healthy work environments. Fewer than 300 of the 6,000 intensive care units in the U.S. have achieved this 3-year designation. And Sarasota Memorial's Critical Care Unit is the only ICU in the Southwest Florida region to earn this honor. The Critical Care Unit earned its Silver Award following an extensive application process and meeting the following evidence-based criteria: leadership structures and systems, appropriate staffing and staff engagement, effective communication, knowledge management, learning and development, evidence-based practice and processes, and outcome measures. So thank you to Sue Olson and her critical care team for putting this together and serving our patients every day. Let's skip that one and go on to another quality recognition. I want to extend a congratulations to our newly certified cardiac rehab professionals. The Certified Cardiac Rehab Professionals, or CCRP certification, is the only comprehensive professional certification offered in cardiac rehab specialists throughout the national organizations of American Associates of Cardiovascular and Pulmonary Rehabilitation. There are currently only about 30 CCRPs in the state of Florida, and we're lucky to have these 6 of them with us. So congratulations to them. And now I'm just going to go back, I'm going to go back to our mass casualty drill, and we have a little video to show on this too. But last week, Sarasota Memorial and staff, Sarasota County Emergency Management, and the first responders participated in a mass casualty drill involving a simulated helicopter crash on the landing pad of the hospital's critical care tower. The scenario called for several injuries and fatalities, as well as damage to the critical care tower and elevators leading to the helipad. The exercise tested Sarasota County's multi-agency response to the disaster and efforts to rescue mock victims. The victims were triaged and treated by the emergency responders and SMH's trauma and emergency care staff. I know Mickey Watson is in the back, and I've got to just thank him for coordinating that on behalf of our system, because he did a fantastic job and made it very seamless and kept it away from patients who were actually here for real reasons and not for simulation reasons. So, should have a video.
Suncoast emergency responders tested their readiness today during a simulated helicopter crash. SNN's Grant Boxleitner has more from Sarasota Memorial Hospital.
10:05 this morning, we received a call that a helicopter had crashed at Sarasota Memorial Hospital.
A major disaster drill is testing readiness of emergency responders high atop Sarasota Memorial Hospital, right down to a simulated press conference.
3 patients that are a trauma alert. We have 2 confirmed deceased.
In the training scenario, a helicopter crashes on the hospital roof with 5 people aboard. The emergency response is designed to mimic what would happen in a real-life tragedy.
It's a great exercise to learn how to best work together. The fire department has specific needs in how they communicate. Hospital has specific needs. The health department's here. There's public health issues.
Drill participants included Sarasota County EMS, Hospital Public Safety, the Health Department, Sarasota Police, and the Sheriff's Office. Sarasota County Fire Captain Jerry Jensen.
We want to be as well prepared as possible. We work with all of these agencies, and incredibly enough, this is one of the first drills where we brought everyone together, including all the PIOs, including all the law enforcement people.
Reporting in Sarasota, Grant Boxleitner, SNN Suncoast News Network.
So, I think it went very well, and once again, thank you, Mickey, for helping with that. And with that, Madam Chair, have any questions? I'd be glad to answer.
Any questions for our CEO? No, thank you very much.
Thank you.
You have nothing on the consent agenda. Do we have any public comments? No. No public comments. Legal matters, Ms. Caroline Kalish.
I
Chief
have
Legal Officer.
no report.
No report. There being no other business, the meeting is now adjourned.